This presentation will discuss the hormone estrogen and the role it plays in the female body, including the menstrual cycle. Estrogens are a class of steroid hormones which control the development and maintenance of female sexual characteristics. The major hormones which are involved in the ovarian cycle include GnRH, pituitary gonadotropes, LH, FSH, ovarian estrogen, and progesterone. During childhood, the ovaries grow and continuously secrete small amounts of estrogen. This secretion inhibits hypothalamic release of GnRH. As a female will continue to grow and near the age of puberty, another hormone comes into action and plays an important role in stimulating the hypothalamus to release GnRH. This hormone is leptin. It is leptin that determines the onset of puberty in females and is linked to the amount of adipose tissue present. It acts as a messenger from the fatty tissue to the hypothalamus. According to Mareb and Ham, if the blood levels of lipids and leptin are low, puberty is delayed. This is seen in cases where there is low body fat, typically present in those with eating disorders such as anorexia and bulimia, as well as in athletes. Taking a look now at the diagram, we can see that the pathway that occurs when there are adequate levels of leptin in the body. As a result, the hypothalamus becomes less sensitive to estrogen. This then allows for the hypothalamus to begin releasing GnRH in a rhythmic pulse-like manner. In turn, GnRH stimulates the anterior pituitary to release FSH and LH, which then travel via the bloodstream to the ovaries, where they are prompted to secrete hormones, which are mostly estrogens. The major source of estrogen comes from the ovaries, both from the developing follicles and the corpus luteum, as we can see in the bottom of the diagram. Estrogen is also produced in the adrenal glands. This rise in estrogen levels during puberty has the following effects on organs. It stimulates the growth and maturation of reproductive organs and breasts at puberty and maintains their adult size and function. Stimulates growth of body hair and also female pattern of subcutaneous fat distribution, typically on the breasts and hips. Promotes the proliferative phase of the uterine cycle. Stimulates the production of watery cervical mucus and activity of fimbriae and uterine tube cilia. Promotes oogenesis and ovulation by stimulating formation of FSH and LH receptors on follicle cells. Stimulates capacitation of sperm in the reproductive tract. And during pregnancy, it stimulates the growth of the uterus and the enlargement of the external genitalia and mammary glands so that they are functional to support the pregnancy. Estrogens also support the growth spurt at puberty, hence why females grow quicker than males do at the onset of puberty when they are the same age. According to Rothstein, this occurs because bone converts testosterone to local estrogen in females. However, this growth spurt is short-lived as estrogens also cause ephysis of bones to close. Also causes a wider and lighter pelvis, catering for childbirth. Now that we've covered the physical changes in the female body, we will have a look at the hormonal changes, referring to the diagram inspired by Mareb. During the follicular phase, estrogens stimulate GnRH, LH, and FSH. During the luteal phase, these same hormones are being inhibited. Looking at the diagram at the top, we can see that estrogens are the primary ovarian hormones before ovulation, and after ovulation, both progesterone and estrogens are secreted by the corpus luteum. Estrogen decreases the sensitivity of peripheral tissues to insulin and also increases the circulating level of renin and angiotensin II, which can result in sodium and water retention. Hence the reason why some women complain about feeling or looking puffy during. There is also a couple of metabolic effects that estrogen has on the body. It helps to maintain low total body blood cholesterol levels, hence the reason why women under the age of 50 have a much lower risk of coronary heart disease than men do of comparable age. Estrogens also protect against bone loss, as estrogen inhibits the breakdown of bone and is a prevention against osteoporosis. Estrogens are synergistic with human growth hormone. One of the side effects can be that a result of menopause is osteoporosis due to the decreased amounts of estrogen being secreted. Manson explains that estrogen therapy is used to treat certain conditions whereby estrogen levels are low, such as delayed onset puberty and menopausal symptoms such as hot flushes, symptomatic vaginal atrophy. Vaginal atrophy is a condition in which low estrogen levels cause a woman's vagina to narrow, lose flexibility, and take longer to lubricate. Female hypogonadism is a condition in which the ovaries produce little or no hormones, as well as premature ovarian failure, which can cause the vaginal dryness, breast atrophy, and lower sex drive, and is also treated with estrogen. An excess of estrogen, on the other hand, can cause fibrocystic disease, a condition where the breasts become lumpy, swollen, and tender a week before menstruation begins. Tutora explains that this is probably due to an excess of estrogens or a deficiency of progesterone in luteal phase of the reproductive cycle. Thank you for listening. I hope you learnt something about the role of estrogen in the female body.